Everyone talks about the bad side effects of steroids, the weight gain, the mood swing, and the high blood pressure. But many of you who are dealing with autoimmune condition, including rheumatoid arthritis, these steroids might be the reason you are able to walk, you are able to go to work, and you are able to enjoy your life with your family and friends. Today, I'm talking about 3 success stories on how we can effectively and safely use steroid to manage your autoimmune disease, including rheumatoid arthritis. Let's stick around. This is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc, as well as a practicing rheumatologist here at Empower Arthritis. Before I go further, don't forget to like and subscribe to our video. And also don't forget to accept our gift, the free copy of the Holistic Rheumatoid Arthritis Guidebook, as well as a free smoothie recipe. So the case number 1 is a 42-year-old teacher who came to me with a history of more than 3 months of joint pain, severe swelling in her joint, and she was not able to use her hand. And we diagnosed her with rheumatoid arthritis. And in her case, we started her on a bridge therapy of steroid. Now, many of you who may not have watched our earlier video, let me quickly explain what a bridge therapy is in steroid. When you are initially diagnosed with rheumatoid arthritis, the medication that we use for long term, we call disease-modifying anti-rheumatic drug. They take time. They don't work immediately. Some of the medication like methotrexate takes several weeks to months for it to be effective. At that time, when you are waiting for that long-term medication to kick in, you need some other solution to help you feel better. And steroid could be that tool. It can help you manage your symptoms till your long-term medication start working for you. So we call this a bridge therapy. It's like a bridge when you're trying to go from active rheumatoid arthritis to the state of remission where you don't have any symptoms. So steroid could be that bridge when you are trying to manage your rheumatoid arthritis. So in our patient, we use steroid as the bridge therapy. And the success story, she was able to manage her disease very well. She was able to achieve remission by 6 months. And now she came back to me after a couple of months, very happy. She was controlling her disease very well, and she was also able to successfully taper her steroid by 3 months. So she did not need to use steroid long term. So in this patient case, we effectively managed the RA very early with aggressive treatment with a disease-modifying anti-rheumatic drug, and we managed her symptoms of rheumatoid arthritis by using short course of steroid. And she was able to come off of steroid by 3 months. So the take-home message from this patient case is early intervention is the key in preventing long-term damage to your joints and reaching that steroid-free remission very early. So if you have rheumatoid arthritis, if you are in that early phase of rheumatoid arthritis diagnosis, ask your rheumatologist how we can aggressively and effectively manage your RA with disease-modifying anti-rheumatic drug as well as a bridge therapy of steroid, which can help you feel better faster and we can achieve disease in remission very early. So the second case is a 58-year-old construction worker who came to me with more than 10 years history of rheumatoid arthritis. And unfortunately, he has been on multiple disease-modifying anti-rheumatic drugs without much luck. He still had quite active rheumatoid arthritis. And because of that reason, he had been on and off prednisone for more than 3 years. This is not ideal, but sometimes when your disease is so active, we might need to use steroid to help you control your disease. And in his case, there was a challenge of steroid dependence because of multiple flares of his disease. His rheumatologist tried his best to taper off the steroid, but every time he tapered the steroid below 10 milligram, he went into a flare and he needed that 10 milligram for long term. When we started working with him, we modified his disease-modifying anti-rheumatic drug. We added a biologic medication that effectively manages RA, and we were able to achieve remission. But by 6 months, when I last saw him, he was still on prednisone. After we optimized his disease-modifying anti-rheumatic drug and biologic, we were able to slowly start him on a steroid taper journey. And we did it very slowly. We decreased his prednisone by 1 milligram every 4 to 6 weeks. with close monitoring of his symptoms. And the symptoms we monitor was for two things. One is his disease, that is his RA symptoms. We closely monitor for any RA flare symptoms, but we also closely monitor his steroid withdrawal symptoms. If you haven't watched our earlier video on what is steroid withdrawal, please go back to those videos. I have explained that in much detail. But basically what it means is steroid withdrawal is as you taper your steroid, your body is still trying to adjust to the newer level of steroid. Your adrenal gland, which typically make the cortisol, is still not waking up. It is still sleeping and it's not making the cortisol that your body needs. That is what we call steroid withdrawal symptoms. So we monitor his both the RA symptoms as well as the steroid withdrawal symptoms. And with those two, we were able to capture his disease. We were able to control his disease and also minimize the steroid withdrawal symptoms. And with that strategy, we were eventually able to get him off of the steroid. So the pro tip from this case is if you are on chronic long-term steroid, be patient. Slowly taper a steroid with closely monitoring for your symptoms of RA as well as symptoms of steroid withdrawal. So work closely with your rheumatologist. Hi, all of you rheumatoid arthritis warrior. Hope you are learning more about these success stories. It might give you some boost on how you can effectively manage your RA, also help you get off of the prednisone. If you like the video, don't forget to like and subscribe to our channel and add some comments so that we can understand how you are dealing with steroid in your RA journey. So the third case we're talking about is the impact of lifestyle changes and diet when you are taking steroid. We have extensively discussed this in earlier videos. If you want to discuss more, go back to those earlier videos so you can find more detailed content. But this patient that we're talking today is a 50-year-old homemaker mom who came to me with rheumatoid arthritis diagnosis for the last 5 years. And because of her recurrent flares, she had gained weight on recurrent use of steroids. And she also had some issue with mood swing while she was taking the prednisone. So we created some action plan. We created some lifestyle changes for her, including dietary changes and other changes that helped her manage the side effect of steroid. She was able to incorporate Mediterranean diet, which helped her maintain her weight. She was also able to incorporate exercise in her daily routine. Both of them help her manage her weight. And we also create some strategy on giving her better sleep. All of these lifestyle changes helped her manage the side effect of steroid very effectively. And the end result, she was able to manage the side effects, minimize the side effects, and was also able to maintain a good weight that eventually helped her control her rheumatoid arthritis. So don't underestimate the power of lifestyle changes in managing rheumatoid arthritis as well as the steroid-related side effects. Now, all of these three cases help us understand the importance of three important things. The number one is the partnership. Your RA journey is a long journey, so you need help from your rheumatologist, your primary care doctor, and other healthcare provider involved in your care. So work closely with those healthcare providers so that you can effectively manage your condition in support with those doctors and the providers. And when you are working with them, communication is the key. So effectively communicate to your provider so that they can understand your symptoms and help you guide on what to do next to manage those side effects as well as the disease flare. And the number two, as we discussed, managing RA is a marathon, it's not a sprint. A slow and steady approach helps prevent your flares as well as minimize steroid withdrawal symptoms. So closely work with your doctor, having some patience. And the proactive care, always adjust your medication. If you're not doing well with the RA, ask your rheumatologist to make medication changes. If you are having side effect with the prednisone, ask them if we can quickly taper your steroid. So be proactive in your care, and understanding these symptoms of steroid withdrawal as well as RA symptoms help you manage your disease more proactively. And here are the 4 important key strategies that you can follow to help you achieve disease remission without needing steroids. The number 1 is early control of the inflammation. Reducing the inflammation rapidly in the first 3 to 6 months is the key for long-term success of rheumatoid arthritis treatment. Number 2, always ask your rheumatologist regarding starting the steroid-sparing agent. That includes the disease-modifying anti-rheumatic drugs or biologics. And these medications are the key for your success in coming off of the steroids. Number 3, if you are on long-term chronic steroid, taper it very slowly. So meticulous taper regimen is the key on minimizing steroid withdrawal as well as the disease flare. And the number 4, don't underestimate the power of lifestyle changes. Managing your weight, managing your diet, regular exercise are as important as the medication for managing RA as well as steroid-related side effects. And follow these 4 pillars to help you effectively manage your RA as well as minimize the use of steroids. And here are the 4 action items for you today. The number 1 is review your current plan with your rheumatologist. When you go to your next appointment, ask your rheumatologist what is our plan on how to effectively manage RA and how to get off of the prednisone. Number 2, always track your symptoms. The symptoms of rheumatoid arthritis flare as well as symptoms of steroid withdrawal. And number 3, discuss the tapering options. When your rheumatologist put you on prednisone, ask them what is the end date for your prednisone. Always have that end in mind before starting the prednisone. And the number 4, focus on the daily support system. That includes prioritizing your anti-inflammatory lifestyle, the diet, the exercise, and your sleep. And many of you rheumatoid arthritis warriors, you might feel lonely because you are on this prednisone, you are on disease-modifying anti-rheumatic drug, and you're worried about it. But you are not alone in this journey. And we are here to support you in this journey by providing this easy-to-understand information. So if you like this video, please give us a thumbs up. Please subscribe to our channel so that you can get similar content in the future. And if you have any other questions, please drop them in the comment below so that we can help you understand better about these medical concepts in rheumatoid arthritis. And remember, you are not alone in this journey, and we are here to support you, and success is possible, and your voice matters in your treatment journey. And with this, you have a very brighter future ahead, even you have rheumatoid arthritis. With that in mind, always take care of your health. I'll see you in the next video. Bye-bye.